if I got tested today and a positive test came back and I just have mild symptoms, what's one of the first things that I can do while I'm at home?
Well, if you're not having really shortness of breath, you're probably okay. But if there's any kind of lung discomfort or shortness of breath, it may be worthwhile investing in a device called a pulse oximeter. This is a device that just slips onto your finger.
And it basically tells you two different things. Number one, it tells you what your pulse is, your heart rate, and it also gives you something called the SpO2. That's your oxygen saturation.
Now, generally speaking, if your oxygen saturation is 95 and above, then you're probably okay. If it starts to drop down, however, at rest between 90 and 94, then you're kind of getting into sort of a yellow zone, if you will, a caution zone.
But if it drops less than 90%, so if it's in the 80s, in other words, then that's more of a red zone. That's where you are clearly hypoxemic, and you'd probably need to go into the emergency room to be evaluated for supplemental oxygen.
If you don't have a pulse oximeter, some of the surrogates for this would be persistent shortness of breath, or if you have cyanosis or blue lips or tongue. Now, it's possible to have shortness of breath and not need oxygen, but if you don't have the ability to measure your oxygen, your peripheral oxygen saturation with a pulse oximeter, then that's the next best thing, is looking for shortness of breath and seeing if you need to go to the emergency room.
Now, if you're already on oxygen as a baseline because you've got lung disease, then you should be on your regular amount of oxygen, and your oxygen saturation should be kind of where you're used to it being. If it starts to drop down, that would be the same sort of situation where it's time to go to the hospital and be evaluated, because that could be a sign. A low oxygen saturation could be a sign that you're getting pneumonia from COVID-19.
You know, there's a lot of different pulse oximeters out there that one could purchase. There's the medical grade ones for maybe a couple $100. There's the type that you show that just go on a finger and are really small and portable. Some of those sell online for as cheap as $20. How can someone tell what's a good pulse oximeter to consider buying?
Well, they've actually done some tests to see how accurate they were, and we'll post that in our description below. You can see here the ones that seem to do well on at least independent evaluation.
Any other tips for using it? Anything that people should know when they're using a portable pulse oximeter?
Yeah, it's just like taking a blood pressure. So you need to be sitting down for a couple of minutes, not doing anything exertive, and be at rest. Slip it on your finger. Don't take the first number that pops up. It's got to sort of learn your pulse a little bit, and so give it about 30 seconds to adjust, and then read the number off.
What about nail polish, if I'm wearing nail polish?
Yeah, so you want to make sure that it's reading the color of your blood. So you don't want to have any nail polish on the finger that you're using it on. So that's a good point. You want to remove the nail polish on the finger.
What if I live at high altitude, say in Santa Fe, New Mexico at 7,000 feet?
Yeah, so as you go up, that's a natural reason for your oxygen saturation to drop. So high altitude would be one of those things. And you may want to have somebody who's not at risk or having COVID symptoms to put it on, just to kind of see what it would be normally at that level. If you're up at 15,000 feet, 10,000 feet, a normal person's saturation is going to be probably in the low 90s, high 80s.
What is unique about COVID-19 and this virus, the SARS-CoV-2 virus, that makes the pulse oximeter so relevant?
Yeah, it's the thing that we learned about very early on during the pandemic in New York was these, quote, happy hypoxic. So in other words, they look fine in every other way, except for the fact that this pneumonia is really preventing oxygen from being diffused into the pulmonary circulation. And it's really one of the first signs that people are starting to progress. So I think it's a very sensitive tool to use, is hypoxemia, and it can be very valuable.
How is hypoxemia different than hypoxia?
Okay, so hypoxemia is specifically the lack of oxygen in the blood. Hypoxia is the lack of oxygen in the tissues. So it's a very specific thing, but for our purposes here, both are happening at the same time.